Welcome once again, friend. Myself, Dr. Naren Singh Chauhan, and today in this session we will be discussing the MBBS third professional pre-university exam from the Government Medical College Haldwani ENT subject MCQ questions. So, beginning with the today's session, the question number 1 in the exam was that keratosis obturans is commonly associated with. So, this was the most confusing question and everybody was wondering what the correct answer of this is. So the correct answer of this question is keratosis obturans is commonly associated with bronchiectasis. So answer is A. As we have mentioned here that patients suffering from keratosis obturans and have a history of bronchiectasis or sinusitis is seen in cases of 77% of adolescent cases. So, this statement justifies the correct answer of this question. Now, coming on to the question number 2, which was even confusing because of the objective parts given. So, all are true for Gradingo syndrome except the four option we have, it is associated with conductive hearing loss, it is seen in petrositis, it leads to involvement of fifth and sixth cranial nerve, and it is characterized by retroorbital pain. So we know that the Gradingo syndrome is seen in the case of petrositis. So Gradingo syndrome is actually a triad of three things. The mnemonic for that is RAD, RAD, that is GRAD, Gradingo syndrome. So R counts for retroorbital pain. So our option number D is correct. That is characterized by retroorbital pain. Now, the second part of the triad is abducent nerve palsy. So our option number C also becomes correct. That is, it is involvement of fifth and sixth cranial nerve. And option number B, it is seen in case of petrositis. We have already discussed the Gradingo syndrome is seen in the case of petrositis. Now, we left with only one option, that is the option number A. That is, it is associated with conductive hearing loss. So, Gradingo syndrome is usually not associated with the conductive hearing loss. So the option of the question number 2, the correct answer is question number 1, option number A. Now coming to the question number 3, which says that speech frequencies include. So speech frequencies, as we can see that almost it's looking like every option is correct, and if we generalize the question, then in that case every option will be correct. But the most common frequencies which are used are then the option A is the correct. The answer is 500, 1000 and 2000 hertz. These are the most common. So we will go with the option number A. Now coming to the question number 4, we say that unilateral referred otalgia is due to all of the following except we have to remove the option which is not responsible for unilateral referred otalgia. So going to the question number option number A, that is peritonsillar abscess. We know that tonsillar area pain is referred to the ear. Option number B, we know that ulcer of the oral tongue is responsible for the referred otalgia. Option number C, which says that allergic rhinitis. So we all know that in cases of allergic rhinitis, we did not notice the referred otalgia. So the option number C is the correct answer here. That is the answer of exclusion. Option number D, we know that temporomandibular joint dysfunction usually the patient comes with the complaint of earache, not the complaint of joint pain in the temporomandibular joint. And question number E, that is the cancer of piriform fossa. All the other 4 options are correct. Only the option, that is option number C, is the unilateral referred otalgia. Now, question number 5, which was a confusing question and even is slightly bit difficult for the MBBS student. It says that a child is 3 years, presented with severe sensory neural deafness, and he was prescribed hearing aids, but shows no improvement. Then what will be our next line of management? The child is 3 years old, having a severe sensory neural hearing deafness, and has already been prescribed hearing aid, which has resulted in no improvement. So, in this case, the correct answer is cochlear implant. In cases the child who are born deaf, then if there is no improvement even after hearing aid prescription, then the correct answer will be cochlear implant. We will have to go for cochlear implant as soon as the child achieves the correct age for cochlear implantation. Now, question number 6, which says that all of following may cause tonsillar ulceration. So this was an indirectly asked question, which was similar to the question like which are of the options are responsible for membrane over the tonsil, and whenever the membrane will be shed off, it will lead into the ulceration. So question number 6, which says that then we know that diphtheria is responsible for membrane over the tonsil. Beckett syndrome is almost responsible for tonsillar ulceration. Vincent angina, we know one of the most common cause of membrane over the tonsil, and agranulocytosis. These are 4 options are among the causes most commonly associated with membrane over the tonsil and which also lead to the ulcer over the tonsil. Then the correct answer will be papilloma. In cases of papilloma, we never notice tonsillar ulceration. So this was a simple question, but asked indirectly, and we will reach at the answer by the exclusion method. Now question number 7. Question number 7 was a bit tricky. It says that a 60-year-old man present to the clinic with a 5 centimeter. The dimension of the lymph node is very, very important in this question, and the answer lies in this thing only. In the upper right cervical region and abnormal looking right tonsil. This was the second catch in the question. Assuming this is a squamous cell carcinoma nodal metastasis, means the patient right side of tonsil is involved and the node is also on the right side. So one clue in the question, that is it has not crossed the midline. The ipsilateral lymph node is involved, not the contralateral lymph node. So we know that in ipsilateral lymph node, the grade will be toward the lesser side. Now, going to the second one, that is the 5 centimeter. So, the 5 centimeter of the lymph node lies into the category of N2. So, the answer here will be N2A because it has a single lymph node. The third catch was the single lymph node. Only single lymph node was involved. If the multiple lymph node will be involved on the ipsilateral side, then the option would have gone toward N2B. And if it is contralateral side, then the option would have gone toward N2C. So in this case, the correct option will be option number B, that is N2A. Now question number 8, which says that which of the following is not true about nasopharyngeal cancer? So number 1, A, that is the metastasis to the cervical lymph node. we know that almost all of the head and neck malignancies will metastasize to the cervical lymph node. Now, option number B causes unilateral serous otitis media. This option number B, you know, this is the most common question that is asked in the Neetpg exam. If an adult patient comes to you with a unilateral serous otitis media, we should go for examination of the nasopharynx. It will be surely, almost certainly, it is a case of nasopharyngeal cancer. So the option number B itself is a question in a question for Neetpg. That, and now option number C, that's a treatment of choice is radiotherapy. We know that for nasopharyngeal carcinoma, chemoradiotherapy or radiotherapy is the choice of option. Option number D, everyone know that Epstein-Barr virus is responsible for nasopharyngeal carcinoma, which we have discussed in, we have learned in the pathology classes also, that is Epstein-Barr virus is responsible for nasopharyngeal carcinoma. So the option number E, that is the answer of exclusion in this case, is the most common nerve involved is vagus. Many nerves are involved, vagus can be involved in later cases if the extension of tumor is very wide. But in this question, all the above four options are up to 100% correct. So the question number 8, the correct answer, we go with the option E, that is most common nerve involved is vagus nerve. Going to the question number 9. So it says that a healthy 15-year male presented to the ENT department with the right-sided nasal obstruction. One thing, foul smelling and blood-stained discharge. Second thing. So this is our nose, and this is the right and the left. This is our septum. There is something which is obstructing the right nasal cavity, and it is the discharge is, one is foul smelling, and second part is the blood tinged or blood stained. So the 3 options which are very confusing in this case is, one is the foreign body, that is option number D. If in the option question it has been the 5-year child, then we would have gone towards foreign body. But in cases of foreign body, usually the discharge is not blood stained, it is foul smelling, but it is not usually blood stained. Now, second option is enterocorneal polyp. Enterocorneal polyp can also leads to nasal obstruction, but in that cases also the discharge is neither foul smelling and not blood stained usually. In the cases of option number E, which is that angiofibroma, 2 things in that case, the angiofibroma qualifies for the correct answer is, one is the 15-year male, and second is the adolescent age group and the male group. So we know that angiofibroma is commonly found in cases of adolescent male. It is not seen in case of female. But in that case, the option, in the information given in the question which does not qualify with the angiofibroma is the foul smelling and blood stained. In angiofibroma, we have the frank epistaxis, not blood stained discharge. Neither it is foul smelling. It is known as torrential epistaxis or torrential bleed. So the option we are left now is the simple nasal polyp and rhinolith. So in that case, in cases of simple nasal polyp, we didn't found the foul smelling blood stained discharge. So the answer by exclusion here is our rhinolith. The rhinolith will leads to, if there is a unilateral rhinolith, it will leads into the nasal obstruction. So it qualifies with first. And rhinolith formation is a continuous chronic process that it will lead to the foul smelling discharge, and due to the space occupying nature of the rhinolith, it can cause trauma to the nasal mucosa. So the discharge can sometimes be blood stained. So this all three things qualifies to the rhinolith as the correct answer. Now question number 10, we say that best section in CT scan for maxillary sinus is, in every section of the CT scan we get one or other information about the structure and anatomy and the pathological condition of the paranasal sinuses. But for maxillary sinus, the best cut is our, as shown in the diagram, the best cut is the coronal section. So we can get information on the axial scan, sagittal scan as well as transverse scan also. But the correct answer here is coronal section, because in that section we get the maximum amount of information about the maxillary sinus as well about the osteometal complex. So this finishes with our the MCQ part of the section of ENT exam of Pre-University from Government Medical College Haldwani. Stay tuned. If you like the video, kindly share and subscribe, and wait for the upcoming video which will discuss the part B of the exam, that was the theory part. It was the MCQ part, that was the long question part. So stay tuned. Thank you.